Medicare Part D is the part of Medicare that covers your prescription drug costs. But what if you don't take any medications? Well, today I'm going to talk about what your options are as a Medicare beneficiary if you really don't need prescription drug coverage right now. Hi, Stephanie Apt here. More and more frequently, I am talking to seniors who are taking no medications or hardly any medications, and they're wondering if they really need to purchase a Medicare Part D prescription drug plan. So I wanted to cover some of the basic information that you need to know if you're looking at Medicare Part D options and you don't take any medications. Generally, if you want to sign up for a Medicare Part D prescription drug plan, you have a 7-month window in which to do so based on your initial Medicare eligibility. So let's say you turn 65 in June. In this example, you could enroll in a Medicare Part D prescription drug plan up to 3 months prior to your birth month for a June 1st effective date. So anytime starting in March in this example for a June 1st effective date, or anytime up to 3 months after your birth month. So in this example, you would have until September to enroll in a Medicare Part D prescription drug plan. Now, Medicare does not require you to have a Medicare Part D prescription drug plan, so you could just not enroll in one. But if you do not enroll in one during this 7-month window, you will have to wait to enroll in a drug plan until the Medicare annual election period. And this happens every fall between October 15th and December 7th. And when you enroll during the annual election period, your coverage won't begin until January 1st of the following year. Now, here is the important thing that some folks don't realize. There is a Medicare Part D penalty for Medicare beneficiaries who have gone without credible Medicare Part D coverage. It's called the Medicare Part D late enrollment penalty. So let's say, for example, that someone decides not to enroll in a Medicare Part D plan right away, but then later on down the road, if they decide to enroll in a Medicare Part D plan, they'd have to wait until the annual election period that fall, and their coverage won't begin until January 1st of the following year. The late enrollment penalty is typically 1% of the Medicare Part D national base beneficiary premium for each full uncovered month that the person went without credible Part D coverage. And Medicare, not the drug company, determines this penalty, and Medicare bases this off of the average Medicare Part D premium nationally that year. For example, the national base beneficiary Part D premium for 2019 is $33.19. The monthly penalty is rounded to the nearest 10 cents and added to the monthly Part D premium. So here's an example of how the penalty works. Let's say, for our example, that this person had been without Medicare Part D or credible Part D coverage for 30 months. And we know that the Medicare Part D national base beneficiary premium is $33.19. So 1% of that is going to be 33 cents. And 33 cents times 30 months, the amount of time they were without coverage, is $9.90. So that's the penalty. So this person has accumulated a Part D penalty of $9.90, and that amount is going to be added to their Medicare Part D premium. So they'll have to pay that in addition to their Part D premium every month for as long as they have a Medicare Part D drug plan. So if you're not taking any medications or taking very few, you could choose to not enroll in a prescription drug plan, or you could simply enroll in the lowest cost Medicare Part D drug plan for your area in order to avoid that penalty. In many areas, the Medicare Part D drug plans begin at $10 to $15 a month, so the premiums can be relatively inexpensive. Now, the good thing about Medicare Part D drug plans is you can always change your Part D plan during the annual election period in the fall between October 15th and December 7th. So if your needs change, if you start taking some new medications, you want to switch up your drug plan, you can always do that during that annual election period in the fall. And right now I'm going to show you a very simple way to find and enroll in the least expensive Part D drug plan in your area and how to do that all online. Hi, I'm down here now. I'm going to show you how to enroll online in the lowest cost Medicare Part D prescription drug plan in your area. So you're going to start off on the Medicare.gov website. This is the government Medicare website. Lots of great things that you can do here. And you're going to click the green button that says Find Health and Drug Plans. From here, it's going to prompt you to enter in your zip code, and then it's going to ask you some questions about how you get your Medicare coverage. For our purposes today, I'm just going to click I don't know, and I don't take any drugs. And this is just a way to view all of the available drug plans in your area sorted by lowest monthly premium cost. So when you click on I don't take any drugs, it's going to automatically sort the plans by which plan is the least expensive. And then we're going to go to continue to plan results. It will give you some options here, and you'll click on prescription drug plans with original Medicare. And then here the results are filtered by the lowest estimated annual retail drug cost. So since you entered in that you take no medications, it's going to show you drug plans sorted by the total lowest monthly premium. And you can see in this area, the drug plans start at $12.90 per month. You can view all of the available drug plans in your area here, and you can enroll online by clicking this enroll button. When you enroll online, this process is incredibly simple and easy. All you have to do is enter in why you're enrolling in a drug plan. Usually it's going to be because you're new to Medicare if you're turning 65. And then it will ask you to enter in some information like your name, your date of birth, your email address, your home address. And it will ask you if you have any other types of prescription drug coverage, like employer drug coverage or VA benefits, things like that. From there, it will give you a couple options on how you'd like to pay for your monthly plan premium, and then you just click continue enrollment until you reach the last screen. The entire process takes less than 5 minutes. It's very simple, and this is the easiest way to get set up on a low-cost Medicare Part D drug plan if you're not taking any medications. So in summary, you do not have to enroll in a Medicare Part D prescription drug plan, but if you don't enroll in one when you're first eligible, you may face a penalty down the road if you decide to enroll in Part D drug coverage later on. Thank you so much for watching. Please feel free to like this video, subscribe, and comment below with your questions. If you have any more specific questions, you can always reach out to me via phone or email. I am a licensed broker and I work in most states. I would be more than happy to help you. Thank you again for watching, and we'll see you soon.